Okay, guys, this is Dr. Sean, and we're going through the anatomy and physiology stuff, so that's what this is really for. And we're going to talk about differential diagnosis. What differential diagnosis is when you have a patient. Now, I know you guys that are doing this other stuff, which is for like either medical assisting or dental hygienist or respiratory therapist or LPNs or CNAs or whatever, you're not going to have to worry about diagnosing. Although it helps to kind of understand it. So here's why we want to do that. When you have a diagnosis come up or you have something that you're questioning, someone comes in with a couple different signs and symptoms. So signs are things that you can see, symptoms are things that they tell you. You can have objective ones and subjective ones. So subjective are the things that they say. I feel tired is subjective. I'm achy is subjective. I'm um, nervous is also subjective. Now you have some objective things you can see, which objective means you can see it as the provider. So you see like, oh, you look flushed. That's objective. They can say I feel hot, but you can feel them and go like, okay, yes, I can verify that objectively and say you do feel hot. In fact, you have a fever, which is an objective finding. So objective findings are ones that you discover regardless of what the patient says. So those can be blood pressure, temperature, pulse, respiration rates, um, observations of lacerations or bruising or what have you, deformations. You can also do palpation. You can say this is tight, this is loose, etc. Now, next, you'd have to do your assessment, which is basically this is like SOAP notes. If you guys have heard of SOAP, you'll put them over here. SOAP is SOAP notes, which means subjective findings. They tell you what's wrong with them. My back hurts. Objective findings. Oh, I found some spasms. Assessment is, well, I think it's probably this, and then what's your plan of treatment really is what it is. But your differential diagnosis is an important thing. Differential diagnosis are what are the different things it could be. You think it's this or this, but you want to have some other things you want to really rule out. Always start with the worst possible thing. Generally, you start with like, could this be something really bad? Cancer, a stroke, a heart attack, internal bleeding, external bleeding, whatever, something like that. That's what a differential diagnosis is. And you want to mark those down as a rule out, maybe. You can do that if you're doing more extensive studies and stuff like that. I want to rule out that this is a heart attack. So let's take some cardiac enzymes, or let's do an EKG, right? Take, we have noticed that the blood pressure is all crazy, all wonky. The systolic and diastolic are all off. Those are the different measurements, right? Or your pulse is rapid and they're looking flushed. That could be a heart attack. That's a differential diagnosis. Now, they could also have gut cramps with all of that. They could have a gut little bubble in their gut and it's causing distress. Total possibility. Other differentials would be like, could it be cancer? Could it be something related to this area? Now you're going to go, well, I think this is more of a cardiac event, or it's a vascular event, or it's a respiratory event, or it's some other metabolic event, or something like that, or traumatic event. And in that case, you want to write down a couple different diagnoses. Now, this is why in the anatomy and physiology class we go over a lot of physiology, and physiology gives you the chance. I know there's some blinking lights here. Physiology gives you the chance to understand how things work normally. Good thing, right? If we learn how they work normally, then we can find out what's normal and what's not. Now, finding out how things don't work normally is called pathology, and that's also an important study aspect of what you'll get into later. Now, I know that some of these classes that you guys are taking, it seems like they're throwing you in and asking you to do all these weird, like alkaline phosphatase and vitamin C and all these weird things, and you're not going to use it in your everyday, but it's kind of like guiding you on how to start thinking. What else could it be? Okay, keep the options open. Like many people, if you say like, "Oh, I know what that is. That's this," but you should always say, "But it could be," because you don't want to be wrong with with something like that. Okay, we want to be able to diagnose and have the right diagnosis by ruling out the differentials, the other ones that could be in weird cases. Now, there's always going to be a wild card in there. There's always going to be something that doesn't show up. If you ever watch TV shows like House or um, any of those other kind of like detective medical shows, it's always something different. Like if they ever go across overseas, it's always a parasite or some kind of bacteria or some kind of fungus or something like that. And there's all kinds of anomalies that can happen in people normally too. So what's an anomaly? Anomaly is a thing that really doesn't cause any problems with them, but it's different than the mass majority of people. Okay, like I have an anomaly in my spine. I have an extra bone. So what happens is my sacrum, the bottom part, which you see up there, right down in there, right there, that bottom part didn't fuse together when I was little, and I have an extra lumbar vertebrae. So I have six, and you guys have five. Okay, more physiology. Now, does that cause me any big problems? Nah, not really. Sometimes it causes me more back pain because I have the same number of ligaments that all y'all do, and there's just a little bit more motion in there, so I have to do like plank and stuff like that a little more often. So anyway, just wanted to get through to you guys on 5 minutes real quick on differential diagnosis and soap notes and stuff like that. Keep doing your stuff. You guys are doing really good. I'm really excited to see how you guys are doing so well. I'm going to send this out to you today, sometime in July, whatever. We'll talk to you later. Bye.